Hello, everyone. Welcome to the 7th COVID-19 CommunityResources.com Town Hall meeting, powered by the Center for Closing the Health Gap. We have so much to talk about today. Our topic is going to be testing. We're going to answer all your questions. Some of you have already started entering your questions. So let me just say, before I introduce our panelists, feel free to start putting your questions if you're on Zoom in the Q&A. If you are on Facebook, put them in the chat. And some have already started to come in because we just have a lot to talk about. I always have to give a shout out to our tech team. Thank you so much, John Reichel and Lauren Harden. They keep it all running. Renee Mahaffey Harris, the president and CEO of the Center for Closing the Health Gap, is helping on the tech today too. But she has a really exciting announcement about a new testing site, but we're going to let her say that at the end of the program. I also want to let you know the program is being recorded so that we can post it on our website, and anyone who missed this can always view it later, okay? So let me introduce our panelists. I'm so excited. I mean, we just have a powerful panel today. We have our Cincinnati Health Commissioner, Melba Moore. So excited to have her on. She is working hard for you, for all of us, making sure we get the information, that we're staying safe, we're getting healthy, that our health needs are being met, and we are so proud of her and always so thankful that she takes time to come in and talk with the community. I don't know, I'm guessing she never sleeps, so I don't know how she gets all this done, but she's out there working super hard, and we're just really proud of her. Also, we have Dr. Nita Walker, Senior Vice President at UC Health. I've known Nita a long time. She is just phenomenal. I remember being at a luncheon with her, and she was telling, this is way before COVID, she was telling us, how we need to get our flu shots. And she made such a strong point that I left that luncheon, went straight to Walgreens and got my shot. I mean, when Dr. Nita Walker speaks, everybody listens. So I'm really happy to have her. Dr. Paul Waller from TriHealth is joining us as well. I know there's some tech things going on. Dr. Waller, are you actually on the call yet?
I should be. Can you hear me?
Yes, we can hear. We can't see you, but we can hear you. And so that's half the battle. So Dr. Waller, welcome. I've known Dr. Waller a long time too. He used to be my husband's doctor, and then he switched his practice to something else. Now he's back, and we're so happy to have you here. Also, his wife, Dr. Angelique Gloucester, is my son's physician. So I feel like this is like a whole family thing today. I'm just really excited. So thank you, everybody. Thank you for coming. I'm going to ask each of you, because we already have questions coming in. So I'm going to ask each of you to just make a few brief intro remarks, and then we're going to get straight to questions. So let's start with Commissioner Melba Moore. Thank you so much.
Good afternoon, everyone, and thank you, Councilwoman Kearney, for allowing me to just be here, to be with the community and share some thoughts. Being a health commissioner, you're tasked with a lot, but your focus is the community. My focus is the community, and I just have to give this one charge to everyone today. The weather is beautiful. You're here with us today. I want you here with us later too. Wear your mask, wash your hands frequently, and clean those frequently touched surfaces. Thank you.
That is good advice. That is good advice. So I love that. We have to be careful. Although things are opening up, we have to think for ourselves and be really careful. Don't just get out there and, go crazy, because COVID is still out there. Okay, thank you for those words. Dr. Walker?
Yes, good afternoon, everyone. Good afternoon, Cincinnati. I'm Nita Walker, Senior Vice President of Ambulatory Operations at UC Health. First of all, I want to say definitely wish our veterans and our service members and thank them for their sacrifice and their service. We know that in our community, we disproportionately serve in the armed services, and we're very proud of that service. And I want to thank them and for all that they do now, and thank them for all that they've done in the past. I echo the sentiments of the commissioner, totally agree that we want to stay safe. We're all very concerned about what this weekend will mean in terms of COVID and what we will see after this weekend when so many things are open, so many people are out. So hopefully we'll have an opportunity to talk about how to get tested. We'll have an opportunity to talk about how to stay safe. Thank you.
Absolutely. Thank you, Dr. Walker. Okay, Dr. Waller, we can see you and hear you now.
Happy Memorial Day to all. I am extremely gratified to be able to participate in this webinar, and to all of the people who are out there. We need to stay safe and practice safe measures. On behalf of TriHealth, who I work for, I am again gratified to be able to participate in this webinar.
Thank you so much. Okay, so we are going to get straight to questions. I appreciate the comments in the chat room. Dr. Robin Ford is saying good evening. He's a faithful attendee at the town hall meetings. Eric Kearney says, Commissioner Moore, you're doing an outstanding job. Thank you for your leadership and concern. Okay, so let me start with the first question. And I think, you know, anyone can answer this one. What's the difference between antibody tests and active virus tests, and which one do you recommend? There's a lot of confusion about all the different tests that are out there.
I'll go ahead and take that one, Jan-Michele. There are actually 3 different types of tests that are out there. One looks for the virus, and it's called a PCR test, and that's the most common test that's being done. The next test is the antibody test, which doesn't actually look for the virus, but looks to whether or not your body has had a response to the virus. A newer test that's out is called the antigen test. That looks for the actual toxin, and in this case, which is a protein, that the virus sheds that and determines that. All of the tests have different time frames in terms of when they come back, and they also have different meaning in terms of when they come back. The type of test you need depends on what we're actually looking for. If you're looking to see if you actually have active viral disease right now because you have symptoms, then you need a viral test, which is the PCR test, or you need the antigen test. That test is not as widely available at this time.
Okay, thank you so much. Here's a question, and this question is from someone who's anonymous, and I should just remind all of you, we love it when you put your name in, but don't feel like you have to. So this question says, and this is a really good one, what is the purpose of testing? If you have COVID-19, then you have it. If you get tested and don't have it, it doesn't mean you won't get it. So I don't see the point of testing. Okay, who wants to take that one on?
Well,
I'll take it.
Go ahead, Dr. Waller.
I think that testing is very important. I think that testing on a broad base is even more important. Over the last 3 to 4 months, before we locked down, I'm pretty sure that I was seeing patients who were returning from the Far East who probably already had COVID. Mm-hmm. Due to the fact that we did not have a test, we had no idea that they had COVID, and COVID continued to spread in the community. I am still seeing COVID patients that are positive, and due to the fact that we are not doing broad testing, and initially we were only testing people who had been to China, Iran, and Italy. And in the first 2.5 months, we were doing very limited tests. At that time, COVID was still spreading through the community. Mm-hmm. We now have broadened it to where we're testing people who are symptomatic. Mm-hmm. Well, the people who are symptomatic, who come back positive, we already know that they have COVID. But we're not testing everyone, so we don't know the people who are asymptomatic. The people who are asymptomatic, who are not being quarantined, who are working in essential jobs and in essential industry, those are the individuals who are continuing to spread COVID. So testing is paramount. Now, for individuals who are asymptomatic and who do not become ill, they do fine. Mm-hmm. But for the individuals who have comorbidities, mm-hmm. those individuals are in a much tougher situation. So testing is paramount, and we need to do more testing. If we had tests like South Korea, we wouldn't be where we are today. But I'm going to be quiet.
Wow.
Well, I just want to add, just thank you for that. I was sitting there, that hit my heart, because you need to know. Our educational campaigns have been about know your numbers, right?
Right.
Know what's up with your body. You need to know, because let's talk about the person who's asymptomatic. They're walking around, they're at work, feeling fine, no problem, but they go home. So they're at home, right? And maybe it's a multi-family unit that they're living with. And maybe grandma's there, right? And maybe grandma has those comorbidities that Dr. Waller was talking about. The guilt that you feel if grandma gets sick, but you didn't know, right? We need to know so that we can be smarter about what we do and how we protect ourselves.
Right. And so if someone does have it, and they might not have symptoms, but they would still have to quarantine for 14 days. Isn't that right?
Yes.
Okay. All right. So testing is super important. It's a way of stopping the spread. So that was a really good question, though. Now, here's another question. This person is anonymous as well, and that's okay. What do you think of efforts by Apple and Google to use cell phone data to determine whether someone has come into contact with COVID-19? Do you see it as a violation of privacy? And I guess this is about the contact tracing app or something like that. That's pretty new out there. Is anyone familiar with that?
Yes, I am. So this is Dr. Walker again. I am familiar with it. And I think there are two aspects of it. I know that there are many people who are very concerned about contact tracing. Using surveillance data like that certainly has its issues. And I think that there are reasons to be concerned about that. On the other hand, contact tracing is a very important, time-respected tool for determining where infectious diseases occur. It's been used with Ebola, it's been used with TB, measles, you can go down the list. That is how we have been able to contain disease. So I think contact tracing itself is extremely important and vitally important in terms of controlling any type of infectious disease. And there's a ton of science behind it. There's a ton of data that it proves that it works. The question is whether or not those are the right methodologies. And I think we can all have our opinions about that. But contact tracing itself is a very critical part of the public health methodology and toolkit in terms of how you control an infectious disease. And
contact tracing is one of those phrases 2 months ago we never used. So could you just explain a little bit about what that means, please?
Actually, and Commissioner, please come in, because the health department is the one that's charged with doing contact tracing. But essentially, contact tracing is saying once we know that someone is COVID positive, or if they're positive with any disease, it could be syphilis, it could be TB. Once that person is identified, then what needs to happen is they need to tell who all their contacts are. And then those contacts are then contacted to make sure that they don't have the disease and aren't spreading it. Because the one thing we know about, and I think when HIV came out, people got this concept pretty well initially, which is if I have sex with one person and they've had sex with 10 other people, then all of us can get infected and cause that many more people to get the disease. This is no different with COVID. And we did a great job of beginning to understand contact tracing. We did a great job of understanding how we contain an infectious disease in terms of that. And we're in a much better and different place than we are with that disease, but it still remains a very important thing to do.
It is, and it's just as what the name says. Contact tracing. Who have you been in contact with, so we can trace back to find out who they've been in contact with, and so that we can help you stay still, monitor your signs and symptoms, and then take the necessary precautions.
Right. It's so important. And so another question here is from Eric, and he says, where can I get tested? Do I need health insurance in order to get tested?
Well, the first thing we need to know a little bit about Eric is he a healthcare worker? Because right now what we know, the testing guidance is their priorities. There are 5 priorities in which an individual has to meet that criteria. So I would be wondering if Eric has, if he's a healthcare worker, first responder, Does he have comorbidities? What is his age range? And that kind of thing. That's what I would need to know. And then we know very shortly, the governor mentioned last week, and I think this is where the community as a whole will begin to really benefit, is that within our federally qualified health centers, testing is going to take place there. I know that we're in partnership with Closing the Health Gap to get some testing going, and I'll hold that so that Renee can make that announcement. But let me say this, Eric, about testing. I want you to get tested, but I also want you to understand we're going to be on the other side of COVID, and I want to make sure you have a medical home. So that's important too, that you get tested and you have a medical home so that we are more proactive in what we do. The other thing to that, I know he didn't ask, but if you have children, what I want parents to understand, we will get on the other side of this, and school is going to start, and we're going to have safe schools here in Cincinnati for our babies, right? And we know that because Laura Mitchell's going to make sure, and all the partners are working with her to do that. But we can't lose sight on what the earlier conversation was about vaccinations. We want to make sure those babies get their vaccinations to be ready for school as well.
Absolutely. Thank you so much. Here's a comment, and it says testing is available at Mercy and Bond Hill for at-risk citizens or people with symptoms. So that's one of the sites. That's the CEAI site that was open there. UC Health has a site open there. There's several places to go for testing, and we can talk about that a little bit later. And then the next question is, who will be responsible for testing and tracing as we enter the next phase of this disease? And I guess that means now, because we're entering next phase.
Our partners, I would say, I know that UC Health was among one of the first to start testing their client and patients. Cincinnati Health Department will be in that mix. You hear that the testing is going on at Mercy over in the Bond Hill area, and your public health authorities will be doing that contact tracing. We know that we've brought back a lot of employees from temporary emergency leave that have the skills that can do the contact tracing, and understanding that we have a union shop. So you have to bring those individuals back first, and then we can reach and bring volunteers in to assist us. So, and we received a lot of support from our volunteers and other partners who say, we'll help you with that. So we're gonna reach to you and do that, but we needed to bring our employees back first. Public health will be the ones that will assist you with the contact tracing and through our partners as well.
All right, thank you so much. Okay, here's another question, and it's, so this would be to Commissioner Moore. And it says, are the COVID-19 numbers in Cincinnati going up, down, or staying the same?
Very good question. And let me say to my partners before I answer that, I know I've been sending you a report twice a day. I wanted to give my epidemiology team a break this weekend so that they could spend it with their families. They've been working 7 days a week, back to back, getting a 10 o'clock report out and getting a 3 o'clock report out. And making adjustments to that. So with that, our numbers, here's what we know. Our numbers are going up because we have 5 priority areas for individuals to be tested. So the concept, the more you test, the more we're gonna see and find, right? What I am watching are a couple of things. The weather, the hospitalizations, ICU admissions, as well as watching my numbers. And I'm watching my deaths as well. And our deaths are between, in a 14-day average, 2 to 3. Any death is serious for me. But when I look at it, those numbers aren't high when you say 2 to 3, but they're very important that we watch the deaths, hospitalizations, ICU admissions. That's what I'm watching, as well as tracking it and saying, okay, today is May 23rd. 80-degree weather. People are out and about. And I was out, but I had my mask and gloves on. And I saw a lot of people out without masks. So that's why I keep saying, let's be vigilant in wearing the mask. And, you know, get out, do what you have to do, and get back in.
Okay, thank you so much. This question is from Valerie Dowell, and she says, what about testing for the homeless street outreach workers? And I guess what she's saying, are they being tested?
So we know that the city stood up the shelter, our over the Rhine shelter, because we didn't want individuals who are considered homeless to, if they were tested, to go back into a shelter, because we knew that would just spread like wildfire. More than likely, individuals who are homeless, and we haven't done this per se in directly targeting and going out, right? Because we've been following these priority guidelines. But as we open up this testing that's going on in Bond Hill, that's going to be within our immediate communities, we're going to see people, individuals who may be homeless, and they would fall under that potentially asymptomatic individuals and or individuals who have comorbidities that meet that criteria to be tested. So if there are entities, and I know that the Vulnerable Populations Committee work group that is working through the Health Collaborative, they have plans of what they're doing. I know we've been in the congregate settings because that hit us hard where our grandparents are, in those long-term care facilities. So we're still working in there to make sure workers, healthcare workers, and the patient population is tested, because we want to know so we can stop the spread in there.
Okay, thank you so much. Here's another question, and it's talking about drive-through testing. It says the issue with drive-through testing is that many patients don't have cars. So I guess the question is there like walk-up testing?
Yeah, let me explain that. Actually, in the drive-through testing, we can do walk-ups. So patients can walk up in that drive-through testing. You don't have to necessarily be in a car to get that done. It just means that most of the patients don't have to stand in a line with each other. So that's the point of that. So
okay, great. That's good to know. Now this one is about demographics. So it says, what are unknown other, I guess that's unknown other ethnicities on the COVID dashboards? Is demographic data collected as part of the testing process?
So thank you for that question. We have, as you all know, that I'm part of, and Renee is as well, part of the governor's strike force on minority health to address COVID-19 and the data committee. That is our quagmire right now. I don't want to assume that other is individuals who are biracial, or who we see sometimes, if in my reports you'll see refuse to answer, unknown other. I don't know. But what we're doing is we just submitted our interim recommendations to the co-chairs for the strike force, really saying we need race, ethnicity, and primary language. And the reason why that's so important, because everybody is important, and we need to know who they are and the numbers so that we can have the creative messaging to talk and deliver those messages to individuals to say, hey, listen, you're falling in this age group. We know that if you have comorbidities, that you're greatly at risk. When I look at these numbers, and I think it's the Ohio Policy Institute, and they talked about death rates, that's us. African Americans are dying. Our numbers are up, and you see that in my report. But there's still a high percentage of individuals listed in that other and unknown category that we're working on. So we have, across the state, our community partners, our partners on that strike force, have echoed the same thing. What I will tell you that I found a little interesting is that collecting this data has seemed to be a long-standing issue. So you've heard others say, well, you find out a lot in an emergency situation, right? We're gonna seize this opportunity. This is our day. This is our opportunity to seize the moment and bring this forward so that we can make sure we do a better job at tracking. I received funding about 3 weeks ago where Dr. Walker, I haven't had a chance to talk with you, but I will be reaching out to you. I wanna know if it would be possible to provide a refresher course. I have the learning management platform through the consultant that we're working with, has a learning management platform. We can use UCs. I'd like to see the 4 hospitals let us come in, provide that refresher. It's motivational interviewing. Like if I'm not feeling well, and I can only imagine the energy and the traffic in a hospital when somebody comes in, and maybe that information isn't collected. So I want to make sure we have an opportunity to come in and do that.
Mm-hmm.
That is wonderful. Thank you so much. You know, and I want to just thank you too, because I know you've really pushed healthcare providers to get demographic information. You've been emphasizing it's so important to have it. And I know there's some resistance sometimes for, you know, lots of different reasons. Sometimes people are just, you know, I guess, overwhelmed with work, but I really, we all appreciate you pushing for that information because it's so important. We have to look at these disparities. You know, we've got to know. So thank you for that. Another question is, do small business owners, employers need to have their employees tested prior to their return to work?
I think it would be wise for them to have their employees tested prior to coming back into work, because if they have a young worker that is asymptomatic and they're not wearing masks in the kitchen area, then there's a possibility that they could have an outbreak. I have had numerous patients test positive who were not wearing masks, who were not symptomatic, who were working in businesses, and they exposed other colleagues that they have worked with. So testing everyone, I think, is wise, especially if they're going to be working in a concentrated area, and especially if they're not going to be wearing masks. Now, even if they're wearing masks, there's times that you may take your mask off inadvertently to answer the phone or go to the restroom or whatever, and still in a closed area expose other people. I mean, the CDC is saying now that the majority of the spread comes from respiratory droplets, over 85%. And we know the virus can live on stainless steel and plastic, but the majority of the spread is coming from respiratory. So wearing a mask is imperative. Do I think that people should be tested? Yes, I do.
And I would add to that testing is not a one-time only thing. If you're going to do testing and surveillance, you're going to have to do it on some sort of time frame. So you'll probably have to do it every 2 weeks, or when employees leave, let's say they leave the city and then come back. So there are a variety of things about testing in terms of that. So it's one test, one time tells you you're not infected right then, but it doesn't mean that you won't get infected. Still, it means everybody still needs to continue with their precautions.
So that brings up another question that someone sent in earlier, which is, don't we need, and you know, it was that same point that you can be negative today but positive tomorrow. So we need to not just get tested once, but get retested. So how soon before we have, you know, like take home testing kits, and they're saying here that you can pick up at Walgreens or CVS to take home and test yourself?
So the thing about those at-home test kits, right now there are actually a variety of kits that are already available. Many of those kits, unfortunately, are unreliable. So that's the challenge. And the most important thing that everyone needs to know is that the test really should ideally be FDA approved, and not just FDA certified, but FDA approved. Certified tests don't have the same degree of reliability. But we are getting to that point. We've come very far, very quickly with COVID. It took years to identify flu and get a flu vaccine. The flu vaccine occurred fully 22 years after that pandemic back in 1918. So it takes time to get all these things done. So we've come very quickly because of the modern technology we have and science we have, but some of the tests are still not as reliable as they need to be. So if you're seeing an at-home test kit right now, I would question its reliability, but yes, that will be where we're headed ultimately, Jan-Michele.
That sounds great. And you mentioned the vaccine, so that keeps coming up. How soon do you think, I know we don't know for sure, but how close are we to having a COVID-19 vaccine?
There's been a lot of exciting advances that have popped up in the past week or two. And I will say, like I said, I don't think it will take the 22 years it took to get a flu vaccine, simply because we have much better technology right now than we did back at that time. But I think the important thing is the vaccine is going to take a while, mainly because it has to be tested and people have to be exposed. And that's not a quick process. And everybody needs to understand there are probably right now about 100 vaccines, if not more, in development. Most of those will fail. The lion's share of them will fail. There will be one or two that will break out and be what we need. So it's going to take some time. It's going to take probably more than a year before we'll see some of that. Again, precautions, precautions, precautions. Wear a mask, stay distant, be careful about where you're going.
All right, thank you. Okay, now this is kind of a loaded question, and I'm not sure if this person is being sarcastic or not, but I'm going to read it. Okay. Since the President of the United States does not wear a mask and does not get tested, and actually he did get tested, but okay, but the question is testing really necessary? And since most governors have opened up their states, aren't we over the worst part of the COVID-19 pandemic? Asked the panel, he said, it's as if the panel said the numbers are rising, then why would the governors reopen the states? That's a loaded question. Okay, who wants to tackle that? That's political and health all mixed up together.
So I'll go ahead and take it. We can see the questions here. So testing is necessary. That's the only way we can identify who has the disease and then ask those people to isolate and quarantine. So the important thing, again, is once we test people, then we can ask them to isolate. The other part of the question says, aren't we over the worst part of the COVID pandemic? We are over the first part of the COVID pandemic. We don't know what worse will look like. We pray that worse won't look like what happened in 1918 with the Spanish flu, which was we got through the spring and the summer, and then it came back with a vengeance in the fall. And in America, 650,000 people lost their lives and 50 million lost their lives worldwide. So we're over the first part. And what will happen in the second part of this will depend on our behaviors and our understanding of the imperative to care for each other and to make sure that this disease does not spread. And if the panel had said the numbers are rising, then why would the governors reopen the states? I think the governors had a lot of other considerations they took into consideration. Reopening happened for many, many, many reasons, not the least of which is some of the economic impact of COVID. So it's very important for everybody to understand that reopening doesn't mean that the virus is gone. As everyone has heard me say, the virus ain't gone. It ain't gone. And you must continue the precautions. You have to continue them. Otherwise, we will see flare-ups, and we're already beginning to see some things happening in a couple of states. Alabama, unfortunately, down in Montgomery, they didn't have enough ICU beds, so they're already having to divert patients to Birmingham. We don't want to see that. The reopening takes into account that we have enough medical ICU beds to care for people. That's what the reopening is about.
Okay, all right, thank you. Okay, the next question, are PPEs supplied to AA and NA meetings? It would seem these functions are important, if not critical, during these stressful times. And I guess the what the question really is saying is that, people who are in recovery might just kind of slip back because of all the stress, which is perfectly understandable, and need supplies.
Those are the AA and NA are essentially group therapy on a certain level. For now, we have decided at UC Health that our group visits and group therapies should be done via Zoom and other mechanisms. So one of the things that I'm hoping that a variety of organizations will understand is when do you transition, if you can, and if it's appropriate, when do you transition to using other technology for it. But by all means, those organizations should supply that to the people who come to any group settings.
Okay, thank you so much. And so this question says, or a comment, patients may not feel comfortable walking up at a drive-through facility. So I guess the issue is, how can we make them feel comfortable? But it's important to get tested. It's okay if you arrive on the bus. It's okay if, someone drops you off, if you walk there. But how do we make people feel like it's okay?
I think that once they see the process, they would understand that it really is. And we do have a number of people who walk up. They wouldn't be the only one. Our employees walk up, and all of our everyone. A lot of the first responders walk up as well. So many of the people who come to a drive-through site are not in cars.
Okay. All right. Thank you so much. Okay. So we have David from This and That. And David, and it's This and That actually with David and Brenda podcast, great podcast. David is saying, thanks to this week's panel for participating. His question is, are there any plans to set up isolation centers like dedicated hotels for people who test positive for COVID-19 but can't safely isolate quarantine at home? For example, they share a small space with multiple generations of a family. And then David says, thanks in advance for your answers.
This has been and thank you, David, for your question. This has been a discussionary item that we have had with the city leadership. And when we talk about increasing testing, and then so you find out who's been tested, that they're positive, and you want to make sure that you don't put them back into that kind of environment. We worked with our hospitals to set up the Duke Energy Center, an alternative care site. Trust me, as these numbers, everybody's watching the numbers, and the hospitals are watching it, and as numbers rise, and they're looking at hospitalizations, ICUs, within 9 hours, there's something that we can stand up. We were able to stand up the rec center. So if we start, as from an epidemiologist perspective, we look at where's the clustering going on. And through that contact tracing is some of the information that we do assess to find out where are you, or what's your living condition, so that maybe another solution can be provided or offered up. So as the numbers rise, that's what we're going to be looking at, because that is a concern, that if you start seeing clustering areas, that people may or may not have the finance resources. I know that many of our community-based organizations have worked already to purchase space within the hospitals for their populations, So we're looking at it. We know that we're going to have to do something if these numbers rise at a level that we think we need to do something.
Okay.
But that mechanism is already in place.
Okay.
I think that people also have to realize that if somebody tests positive and they're in a 3-bedroom apartment, if they isolate the individual who's positive with a mask and keep them in the bedroom, and now that it's getting a little warmer, keep the windows open and get fresh air and sanitize the bathroom area, and that person stays quarantined in that room, and they bring them their food, and that person keeps a mask on, and the other individuals in the apartment keep a mask on, there's a less likelihood of spread. But ideally, having places where individuals can go and be quarantined would be ideal.
Thank you so much. Okay. And I should just mention that there are some places for some of our first responders, for example, the police and firefighters. For example, Mount St. Joe College offered their dormitory space, and so that's really good. We've got that lined up, and I know they've already started taking advantage of it from what I understand. So that's excellent. Okay, so this is a really good question. What are the comorbidities? All the doctors are talking about comorbidities. And so this is just a really great question. What are they, and how do I avoid them?
I think that we have to realize the comorbidities that are coming out of all the places is hypertension, diabetes, asthma, COPD, any type of lung disease, any type of immunocompromised state, hypertension. And they're even mentioning that patients with vitamin D deficiency did worse. Any individuals who are immunocompromised or on immunosuppressant agent are also at risk. And it's not only impacting African Americans, it's impacting Caucasian Americans, it's impacting Native American, Asian American. It just happens that with our people, with us being more essential workers on the lower economic scale, us having food deserts and having hypertension and diabetes and obesity, and a lot of us not being treated, the comorbidities are magnified. And when they used to say America catches a cold, Black America catches the flu. I mean, this has really impacted our people. And a lot of our people are in those essential jobs, from working in the jails to driving buses to the food service to the gas stations, grocery stores. So it is impacting us even more. Our people cannot sit at home and work from home on a computer. So the comorbidities are throughout our society, but it is tending to impact us even more. And we don't have a treatment for this. Therefore, when you go into the hospital, they're trying HIV meds, they're trying the meds for Ebola, they're trying antivirals. So because we don't have a treatment, it's like you're like a guinea pig. So again, to stress this to our people to stay home, or when they go out to wear their mask, or wear their mask when they're at work, it is imperative. And I'm going to be quiet now.
Dr. Waller, you are making some really good points. You don't have to be quiet. Those are excellent points. Thank you for that. And I should say that the Center for Closing the Health Gap, UC Health, lots of places have been talking about health disparities and trying to get people to realize that there are health disparities. And so that gets to the next, it's really a comment here. And the person says, it is incredible to me that predicting the disproportionate burden of on the minority population has surprised folks. And I guess they're wondering, has everybody been under a rock? It's just people are shocked.
Well, I'll take that question because I'm new to Cincinnati. And I had a team of epidemiologists in St. Louis. And our data collection was not like this. And I heard a state official say this was a long-standing problem. I also know that about 10 years ago here in Cincinnati, some work was done and the reporting was at 64% accuracy and in being complete. And there was an intervention put in place and the rates went up to 95%. So it was a little shocking for me to see that, to see the high numbers of other and unknown, because the other part of that, what the epidemiologist on my team has to do is go back in, reach to those providers, submitters to find out, do the tracing to find out. And that is a huge time constraint that you have to do. So not being critical, but just being aware and recognizing something that you have to push for these things. In our community, we have the information, but in other communities, it's not necessarily so that they have the level of detail that we have. Because if you think about some of the other health departments in those health jurisdictions, they might not have 400 employees. They might have only 1 or 2 programs that they're offering, immunizations, mommy, baby, well checkup. They might not have the full staffing to be able to do that. And then there's a reliance to receive that from our state partners. So what you put in, what you receive.
Right, there you go. Well, you know what? That's why your leadership is so important here. So we're really, really thankful for that. Here's a great question, and I hope I'm saying your name right. It looks like Marcia Shands or Mardia, it might be Mardia Shands. And she says, can you speak to what is happening and that some of us are not seeking treatment for our comorbidities because we're afraid to go to the hospitals because of COVID-19?
The number of people coming into priority cares, primary care offices, and emergency rooms, and the number of EMS squad runs from various municipalities are down over 50 to 60% due to people fearing being exposed to COVID. People are having MIs at home. People are having strokes at home. The numbers are not, it is safe for someone if they have an event at home, abdominal pain, chest pain, just call EMS so that they can be taken to the hospital and be adequately treated. The hospitals and the systems have set up where they would not be at COVID risk for being treated for normal, everyday medical issues. And when I say normal, everyday medical issues, people having appendicitis, people having gallbladder attacks, asthma attacks, people having heart attacks or strokes. But in talking with people across the board, and I work in four different centers around 275, we are finding that a lot of people are scared to go in, and they're coming in much worse condition.
Wow, that is frightening. So we've got to, you know, if it's an emergency, you got to get to the hospital. Absolutely. We've got to get that message out, and the hospitals have precautions. They, you know, they're not mixing patients without COVID with patients with COVID. Isn't that right? Isn't there some separation there, Dr. Waller? I mean, there's some safety.
Correct.
And I echo that sentiment. It's very important for everybody to understand. We have tons of precautions in place. We have separated patients who are COVID positive from others, and it's so important. Do not defer care. Do not wait to get the care you need. You can get it done safely. We can do it safely for you, and it's so important. We don't want you to get sicker while this is going on.
Absolutely. Kelly Prather has two questions. I'm going to put hers together. And she says, hello, Commissioner. Does the Cincinnati Health Department have jurisdiction over facilities in Norwood? That's one question. And then she says, I heard that nursing home staff are scheduled to be tested for COVID-19. Is that true? And if so, when will testing begin?
Well, hello, Kelly. Thank you for the question. I will say that we do not have jurisdiction in Norwood. We're the Cincinnati Health Department. However, there is a health department in Norwood. And if they're scheduling testing, I don't have that information in front of me to know when they're going to go in and do that testing.
Okay, thank you so much.
Actually, I would say that many nursing homes across the city have actually done testing of their employees, as well as particularly those who are symptomatic, as well as testing those who live in their homes. We have worked with a number of those facilities to be able to do that testing in a very quick fashion. We have a test that can be turned around in 40 minutes, and then we have one that can be turned around in 24 hours. So we've been doing that for a number of agencies.
Okay, all right, thank you. Here's a question from Teach Dillingham. And this is really the big one. So how is getting a test a solution when the labs won't test you if you're not sick? So I think that's the issue about needing more testing equipment, right?
We need to change the parameters and be able to have it that we have enough tests that everyone can be tested. We need to be able to test people who are symptomatic and people who don't have symptoms, and that way we will know what the true prevalence is, because that portion of the people who are asymptomatic, if we're not randomly testing them, then we really don't have a sense of where we truly sit. I mean, I just saw in South Korea when they opened up, they were able to trace hotspots based off of contact tracing and notify everybody and have everybody tested in that area. So we need to broaden our testing. We really do.
And I will say, if someone has been exposed, they certainly can. So you may be asymptomatic, but you've been exposed. You definitely can qualify for testing. And another thing I want to mention is that Testing doesn't replace care, so make sure, if nothing else happens, make sure you get connected to a medical home and get a primary care physician. If you haven't done it before, do it now. It's critical to have someone who can be your advocate and walk you through this journey.
Okay, thank you so much. There was a question earlier about Kawasaki disease in children. I didn't know if anyone could address that. In the news lately. There's been a lot about, I think it's called Kawasaki disease, and how that's related to COVID-19. And it sounds, pretty dangerous for children. So would anyone like to give us a quick update on that, please?
A brief update on the Kawasaki-like syndrome. It hasn't been determined that it's actually Kawasaki, but the Kawasaki-like syndrome, it tends to occur after someone has been exposed and potentially had the disease. Some of the children didn't actually have classic COVID symptoms, but it's an inflammatory disease that tends to occur after a viral illness. And so that's not unexpected, and some of the symptoms and things that you see are not unexpected, because this is what happens when your body is stormed and has an inflammatory response because it has such an overwhelming illness. And that's what we're seeing. And unfortunately, it can impact a lot of parts of your body. You've also heard that some people are having blood clots, and that's what happens when you have excess, massive inflammation throughout your body.
Okay, thank you. Thank you for explaining that. Okay, here's a question from Joe Mallory, and people know Joe. He's Vice President of the NAACP and one of our COVID-19 CommunityResources.com partners. And Joe says, is it true that if you don't test within a week of someone that had COVID-19, that it will not show antibodies? So I guess that's back to that antibody testing, because people wonder, and then if you could also add to that, does that make you immune from future COVID-19 episodes?
A couple of things about the antibody testing, because a lot of people are going to want to clamor for it. At this point, what we know is that not everybody will develop antibodies, first and foremost, number one. And then number two, what we really don't know is whether or not the antibody is protective, nor do we know how long the antibody lasts. So having antibodies doesn't mean that you should change your behavior in any way. You should continue to take precautions. I am concerned that many people are clamoring for antibody testing, and there are a number of people offering it in the community. And some for as little as $40, some for as much as $200. But it doesn't really change your behavior at this point. As we get more sophisticated with the antibody testing, and as we see better antibody testing and really understand how this virus is behaving in 3 to 5 months, and maybe in time for school, as many people are hoping and thinking, then it may be that test is more meaningful.
Thank you so much. So here too, and we're almost out of time. I'm going to combine these two questions about homelessness. And it says, if someone who's homeless tests positive, then what? And I did want to point out that there is a facility that the city opened in OTR. But the next question, I'm kind of missing it now, but it said that here it is. The person said, we started at 10 beds, or it said that started at 10 beds for a homeless population approaching 8,500. So I think the issue is that we might not have enough beds at that facility.
Right. Started at 10 beds and on the first floor, and we have a second floor with 10 too. And the idea was that if individuals were asymptomatic, they would be at one level, and the other patients who were identified with being symptomatic would be up, right? So we've been able to manage that very well with getting individuals in and getting them back out. And when I say out, we've had several who have had housing placement. So again, if we get to the point where we're seeing this massive number, it would probably be if we saw 10 people, we're watching that to say we need to pull our next move to open up another facility.
Okay, all right, thank you so much. We are getting out of time. Several people have asked if they might have a symptom, they might not. Can they get tested? Renee Mahaffey Harris is going to speak to that. Dr. Walker, you're shaking your head. Did you want to say something about that?
No, absolutely. People, if you have symptoms, you should definitely get tested. And one of the symptoms I think someone mentioned on the Q&A is a loss of taste and smell. If that happens, we certainly think you should be considered for testing. Contact your primary care provider, and then you can also contact Cincinnati Health Department, and Renee's going to talk about some other options.
Okay.
I think also people need to realize that the symptoms are so broad. I have seen people with GI symptoms. I have seen people with allergy symptoms. I have seen people with sinus and issues, sore throat, and I have even seen people with loss of taste and smell. And then people with the full-blown flu-like symptoms and the fever. And the majority of the people that I have seen have not had the full-blown fever and flu-like symptoms. So it is a pretty broad range of symptoms that people have when they present with it. And then there are people who are asymptomatic.
Okay. And then someone just wanted to give a shout out to UC Health. They said they had a procedure at UC Health yesterday afternoon. They felt safe and they were isolated from COVID-19 patients. So just to assure people, there are lots of other great questions in here that we're out of time for. One was about, what are we going to do in August when it's time for children? Another one was about, is it safe to go swimming this summer? And some of the pools are actually opening, and the rec center, some are opening. So that is a topic that we will continue to address. Go to COVID-19communityresources.com. We will have the answers to all of your questions. We're saving them all. If they didn't get answered here, we'll make sure they get answered on that website. I want to encourage everyone to look at your screen there. There is a survey. Please fill it out. We take those very seriously. They help us with future topics. And I would just like to thank, we have so many great questions, and I'm sorry we didn't have a chance to get to all of them, but as I said, we will get them answered. I want to thank our wonderful, wonderful panelists. You brought so much information. We appreciate you taking the time. Our Cincinnati Health Commissioner, Melba Moore, who's keeping us safe and just working so hard, and we really appreciate everything you're doing. Just appreciate your leadership and your wisdom. So thank you so much for that. Dr. Nita Walker, Senior Vice President at UC Health, you are phenomenal. Dr. Paul Waller at TriHealth, you are phenomenal. And we just
Thank you.
Really appreciate all of you. So you'll have to come back soon. I'd like to turn, we're powered by the Center for Closing the Health Gap, and Renee Mahaffey Harris, the president and CEO, has some really good information for you. So before we close, let me bring Renee on, and I'd like to thank all of you, and I will see you next Saturday at 4. Renee?
Thank you. Well, thank you, Councilmember Kearney, and thank you to our panelists. You all were provided invaluable information, and again, we will answer all the questions that did not get to be responded to on today's town hall. I'm excited to announce that Kroger Health will be hosting their second testing site at Hirsch Recreation Center. It is in collaboration with the City of Cincinnati, with the Cincinnati Recreation Commission, with Councilmember Kearney, Councilmember Sittenfeld, Councilmember Young, our partners, Eddie Cohen with the Urban League of Greater Cincinnati and Northern Kentucky and Southwest Ohio, Eric Kearney with the African American Chamber of Commerce, the president of the African American Chamber of Commerce, Joe Mallory, our vice president of the NAACP, along with Robert Richardson, who is the president of the NAACP, Dr. Roosevelt Walker, president of Cincinnati Medical Association, Cincinnati Health Department, Avondale Development Corporation, Avondale Community Council, the Sentinels, and others. We just thank you so much for joining and advocating for this site to be open in Avondale. Again, it's the Kroger Health pop-up testing site that will be both a drive-through as well as walk-up. And Dr. Walker, I thank you so much for clarifying what UC Health has been doing and your continued commitment and work in our community, along with TriHealth and all of the other health systems, Christ Hospital and Mercy systems as well. So thank everyone for all that you're doing to keep us safe. And as Dr. Moore said, we must remember to practice social distancing, mask up, and wash your hands. And so thank you all so much for joining us. I pray that all of you have a blessed Memorial Day holiday weekend, and thank you to our veterans.
Thank you.
Thank you. Stay safe,
Thank
everyone.
you.
Thank you. It's our pleasure.
Thank you.
Stay safe.
Stay
Yes. Safe.